You know that mental health regarding medicine always is the last spot in the schedule of doctors. And I think that the same happens with the nurses that are working in mental health. The mental health nurse is a specialty in the nursing, and it deals with people of all ages that have mental illness or mental distress. The therapeutic relationship between the mental health nurse with those with mental health illness and their families is critical to successful mental health nursing. Helping people back to mental health is also as valuable and satisfying as caring for those with a physical illness. The main tool of mental health nurse will be the strength of the own personality and communication skills of the nurse. They have to empathize with the people that they are dealing with and show warmth and care about them. I'm very sorry, but still, mental health is a stigma in our society, in all society, and mental health patients are very stigmatic and they are very apart in the society. Combating this and helping the individuals and their family deal with this, with the stigma, is a very important part of the role of mental health nurses. Most of the mentally ill patients are cared in the community and not in hospitals. And the help to lead a normal life of these patients is one of the most important goals in mental health nursing. As I say, is a special branch in the profession that cares about the people of all ages suffering from mental distress, from the birth until 100. The nurses use a wide range of skills like therapies, different therapies, and resources to help and support people in the daily lives. Assisting people resolve their own problems is a fundamental part of mental health nursing. The prevalence and frequency of mental health problems in the society, in all societies, is more or less 1 in 6 people that will suffer for mental distress during their lifetime. This distress may require the help of professionals if it becomes severe and threatens the safety of the person or the people surrounding him. The majority of mental health problems do not fall in this category. As I told you, the mentally health patients are socially excluded. Recurrent symptoms may indicate the need for engagement with mental health services, and it is with this population that the majority of mental health nursing takes place. We have a number of important challenges for the mental health nurse. First of all is providing primary care to the socially excluded. For example, those that are drug addicts or mental health problems. Second, the development of professional skills and knowledge to deal effectively with mental health problems. Providing information to the mental ill patients about available resources, for example, social help, welfare, and voluntary resources. Addressing the physical health care needs of the mentally ill, because most of the time they don't care about their physical problems. They are so much in all the depression or the OCD that they don't care about the physical state. So one of the most important goals of the nurses is to try to convince them that they also have to care about their physical state. Also addressing to them the importance of psychiatry medication treatment. Most of the problems that we have with mental ill patients is that they stop taking the medication, so the relapse is very high. If they have a good relationship with a nurse or with a team, with the community team, they have to convince them that medication, although in the medication, the psychiatric medication, there is a lot of side effects, but if the nurse can explain them about the side effects, and they can explain them also that the medication will guarantee a better life, this is one also of the most important goals in mental health services. The nurses have to be prepared to play their part in these successful outcomes. And it's through education, training, and collaboration with other disciplines that will determine the success of this aspiration. I will talk now a little bit about the responsibilities of the mental health nurse. Mental health nurses are at the front line in providing care and support in both hospitals and in the community. They also can work at the people homes, in resident units, and in local health centers. They are a part of multidisciplinary team which incorporates psychiatrists, social workers, psychologists, general practitioners, and occupational therapists. I want to stress that every one of these professionals in the team is important. It's not that the psychiatrist is more important than the nurse or of the occupational therapy or the social worker. Each one has a role in this team to provide well-being to the mental health people. At the heart of mental health nursing is the one-to-one personal relationship that nurses develops with their patients. This is achieved through a combination of good communication skills of the nurse herself or himself, knowledge of the person and their presenting symptoms, together with an ability to observe behaviors and try to work out the underlying emotions and feelings and thinking that have produced the certain behavior. This means that if the nurse has the knowledge of knowing what's happening or what symptoms have the patients, and he or she can understand what's happening, she or he will be able to help him to overcome this period of acute or chronic illness. The activities that can develop a therapeutic relationship between a nurse and a patient is, first of all, listening to patients and trying to interpret their needs and concerns. Assessing and talking to patients, offering explanation and reassurance about treatment that they are receiving. That is what I was talking about, the medication, that it's fundamental and it's very, very important that the nurse will explain to each patient what's happening with them, because most of the time the mental ill patients, they don't really understand what's happening in the thinking, or what's the voices that they are listening, or what's the things that they are seeing, or why they are withdrawal in society. So if there is a nurse that can explain them the mean or the signification of the illness, this will be very, very useful for the patient themselves. Another thing is caring for patients who are in an acute state or have an ongoing standing mental health problem. The patients that are in an acute state, they can be also very agitative. They can be also suicidal. They want to die. They can be also aggressive. If the nurse can help them to understand that this stage is going away with the medication, they will feel better. It's very useful. Also to the chronic patients, for example, the schizophrenic patients, that they are all the time very sick and they cannot work, they cannot be in society, they are they are sitting, for example, in the house and not doing nothing. If the nurse can come and explain them what's the problem they have and try to push them or to get them to any very small activity, also it will be very helpful for the patients themselves. Building relationships with patients to encourage trust. Responding to distressed patients and attempting to understand the source of the distress, as I told you before. There are also patients that they may be temporarily not able to adequately represent their own best interest. For example, a patient that he doesn't understand, I know that this in our society in Israel, they receive an amount of money from the government because they are not able to work, they are not able to function. But they are also patients that they are not aware of this right that they have. So one of the tasks also of the nurse is to help them to get this amount of money from the government, or that they have the right to a rehabilitation program or something like that. And if they are in an acute state, they don't understand what's happening with their lives. So the nurse can also help them in this period of times to get what they are supposed to receive. As I told you also, encouraging the patients to take part in art, drama, or occupational therapy when appropriate. Organizing social events to develop the patient's social skills, that it is very, very problematic with mental ill patients. As a mental health nurse, they are likely to be dealing with people from a broad range of social, economic, and cultural background. There is no, of course, there is no more mental health illness in the lower parts of the society, mental illness can can be in all social status and economic status. So the understanding of these factors is critical element to build a therapeutic relationship. The mental ill patient can be the richest man in the world or can be the poorest man in the world, can be the doctor or the engineer or the person that is working in agriculture. It doesn't matter the position in society. Mental illness is the same for everyone, if it comes. One difference between nurses and other mental health workers is that mental health nurses are able to forge a long-standing relationship, often spending much longer periods of time working with the patients, and thereby developing the trust essential to effective mental health care. It's not that nurses have more time than doctors. They have the same time. But if we think of the history of nursing, of Florence Nightingale and all these important people, they have a special way of treating with the patients that I think that doctors don't have. Doctors, like me, myself, we have to work, we have to see a lot of patients. Sometimes, a lot of times, we don't have the time to sit down and talk with the patients. Nurses have this. I think that it's a very important character, or a very important thing that nurses have this special way of treating patients. If this was Firgun, the holistic way, thank you. You write it down. You know what is Firgun, please write it down. The community work of nurses. The community mental health teams generally comprise of community mental health, as I told you, nurses, psychiatrists, social workers, and community workers that are partners with other disciplines to provide home-based services for clients and their families. This is a lot of time an alternative to hospitalization, but is also, if the person is in an acute state or he needs hospitalization, this team has also to ease the hospitalization. I was once invited to Congress in Sicily, and it's very nice because they don't have hospitals, psychiatric hospitals. They have community centers that are apartments, and it depends on the grade of illness of the patients. They are the very sick or ill patients that they live in a house with a doctor that is coming to them once a day, a nurse that she is always in the house, and social workers that also are in the house. They are the most also apartments with independent mental ill patients that they need only that once a day somebody will come to control if everything is okay, and they can go to work or to study. And there is in general hospitals one ward of psychiatric ward that for the very, very, very acute patients, and they are hospitalized only for 1 week to normalize the medication, and afterwards they are returned to the community. I think that it's a wonderful system. It doesn't happen in Israel. We have hospitals, psychiatric hospitals, and I really hope that once I will see this kind of community treatment, because it is a lot the life of also the families and also the mental health patients. They are in the society. They are not a part of the society. And this, I think, is with all the medication that we have now, the modern medication, and all the therapies that we have, it's really very important to try to incorporate them in the society and not to isolate them in hospitals that sometimes they are 1 year hospitalized or they are 2 or 3 years. And it's very sad that we don't have this kind of system. These teams, they often work with people between the ages of 18 and 65. But this is not true because I'm a child psychiatrist, child and adolescent psychiatrist. So these teams are also working with kids and adolescents. The community centers are more specific, yes, for adult patients, but also we have some kind of community treatment for kids and adolescents. This kind of community activities reduces the number of readmissions to hospitals by early intervention and identification of the problems. If you have a community team that it's in contact, constant contact with the people, with the patients, they can see when there is a relapse is coming or when they become suicidal. And this, if they treat them in the community, it's very, very important because it reduces in a very significant way the hospitalization of the patient. It develops also services that are responsive and support the person to reach their optimum potential in the home environment. This is what I was talking before, that it's better for the mental health patient to be in society, in their home, than in the hospital. They work very closely with the voluntary and independent services, ensuring that the appropriate interventions are offered. They also support a close working relationship between professionals, resulting in a quicker, comprehensive assessment of the need of the patient. If the nurse is working in a ward environment and in a hospital, they should respond to the need of the people in an honest, non-judgmental, and open manner, which respects the rights of individuals and groups and taking in account the physical, psychological, emotional, social, and spiritual needs of the patients. The interventions that, the nursing interventions that psychiatric or mental health nurses can be involved with is physical and biological interventions, that first of all is psychiatric medications. There are a lot of countries that nurses are permitted to medicate the mental ill patients. In Israel, not yet. It's a very hard struggle between doctors and nurses. The doctors don't really want to let the nurses give medicine because this is what we do. We know how to give medicines, and it's a struggle of power, I think. I don't know what will happen. I really don't know, but there is a lot of places in the world that nurses are giving also medication. Another intervention, physical and biological intervention, is in ECT, electroconvulsive therapy, electroshock. I really don't know what's the status of this treatment. I was in Bethlehem Hospital 2 months ago, something like that. I know that they use a lot of ECT. I don't know what's happening in, yes, a lot. I think that it's also because the lack of staff. They don't have enough psychiatrists, psychologists, or mental health workers. I don't know what's happening in Israeli hospitals. I know that the indication in Israeli hospitals is with very, very depressive patients, that they are very resistant to medication, and also to very suicidal patients, that they cannot take them out of this suicidal ideation. I remember when I was in the stage, I was younger, we were doing electroshock therapy, and I organized a strike because they were doing the ECT without anesthesia. And don't calculate my age, please. But I organized a strike, and I told every young doctor not to be at 7 o'clock in the hospital, so we let the chief of the staffs do this. And at last, we really they start using anesthesia, and of course they didn't like me very much, and I was very, the people of the direction was not very pleased about what I was doing, but it was terrible to see the ECT without anesthesia. I think that now there less and less are using this method, also because of the advance in medication. So it's better to treat, or to try to treat with medication. But there are several cases that it's impossible to get them out from the pathological state. Also, as I told you before, the physical care of the patient, they have to have a good level of nutrition, of sleep, of having a bath, and this also is an aspect that the nurses are caring about. The therapeutic relationship aspect of psychiatric nursing. I think that the most important duty of a psychiatric nurse is to maintain a positive therapeutic relationship with a patient in a clinical setting. The fundamental elements of mental health care revolves around the interpersonal relations and interaction established between professionals and patients. Caring for people with mental illness demands an intensified presence and strong desire to be supportive. There are 9 critical mental health aspects in psychiatry nursing practicum, and I will try to name them. First of all, understanding and empathy. To understand what's going on with the patient and to be very empathic to him. This will help him to recover more easily. Individuality, providing support, being there, being available. And that, you know, I remember when I was in a hospital doing my specialization, and I remember the nurses sitting with the patients and talking with them, and when the patient was in distress or something, they will go always to talk with the nurse and not with the doctor or the social workers, because they knew that the nurse was always there for them. And this is very, very important for the sick people. Promoting equality, demonstrating respect to the mental health patients. They are not less than us. They are the same, and they have a problem. So we have to respect them as human beings, because they are human beings. Also, very, very important is to demonstrate clear boundaries. the limits. I was yesterday in Jerusalem, and there was a mental health patient that every time that I was talking with a doctor, he was coming in and he wanted to disrupt and he wanted to talk. And it was so important for the doctor to put a limit, to say, no, now I cannot talk with you. You have to wait, or you have to wait until I finish this conversation. It's very useful for them. It's not to be bad. On the contrary, it's to help them to concentrate and to be in their own limits, because a lot of times they don't understand what are the limits. So it's the nurse and also the staff main objective, goal is to tell them and to teach them the limits of life, because everyone has limits in life. We have also mental health nurses that they are not only working in community or in psychiatric hospitals, but also in forensic psychiatry. Forensic psychiatry is a work with people who have mental health problems and have committed crimes. It's also a different specialization because it's a different kind of patients. In Israel, they have different wards, they are in different services, not in the same services that the general population of mental health. And I can tell you that it's not a very easy job, and that I also admire this kind of nurses, because it's very, very difficult to work with this kind of population. They also can specialize, they can be also in different areas, such as treating people with Alzheimer or dementia, or people that are drug addicts or alcohol addicts, in rehabilitation, and as I told you, in child and adolescent mental health patients.